our community, the blood reserve, it's the largest geographical reserve in all of Canada. So transportation is obviously a major barrier for a lot of our clients. A lot don't have access to transportation, private or there's not a whole lot of programming to help with that. I do work with our medical transportation program, and in a branch from that program is what we call the Mobile Medical Unit program. And that is really where the medical van through MoveMobility has been a really great benefit to have for our community. It does supplement, like I said, the medical transportation program as well as our home care nursing program. So without getting into too much of those other programs, it really does complement those services nicely. It is kind of specifically related to our ongoing opioid crisis that we've been in for a number of years. It is manned by a 3-nurse team. They use the medical van to deliver opioid agonist therapy medication, so Suboxone and Methadone, from pharmacy on reserve, as well as our just off reserve partners through the town of Cardston. There's 4 pharmacies there. The nurses, they pick up the medication there and then deliver it to those community members who do not have access to transportation. The way the program was set up before, we were basically transporting large numbers of groups in like a bus type vehicle to get their doses at the pharmacy. But of course, of COVID and the risk of outbreaks, that totally squashed that delivery model. With help from a nursing team and the MoveMobility vehicle, we are able to offer that service to those clients. In addition, because of the awesome layout of the unit, they are able to add on extra nursing services that are not available through the home care program, such as phlebotomy, so blood work. We get referrals from the physician clinics that we have on the reserve, so that nurses can actually draw blood and deliver it to the labs, kind of eliminating that need for the client to actually come into the clinic. Another big piece is our sexual health program has really started to phase into the mobile medical unit program. So it does accommodate those clients for a bit of a one-on-one, the treatment space within the unit. It is very stigmatized for anybody having to go into a sexual health clinic and kind of being visible, especially being a tight-knit community, even though we are so widespread. I know there is a lot of apprehension for clients to even request those services. So kind of umbrellaing sexual health within the mobile medical unit program, they are able to have that privacy within the unit with that treatment space within the van. So they can be going in there for blood work or be going in there for a sexual health treatment, anonymous to whatever, you can see the unit going by. There's no identifiers on the van that says it's for sexual health. They did give out vaccines through the van just to catch those groups that weren't coming to our main clinic. Again, probably transportation issues, mobility issues. So the nurses were trained to give the vaccine, the COVID vaccine, to those clients through the unit as well. There is a lot of addiction counseling needs in our community, but having those clients again come into our mental health clinic for addictions counseling is another kind of stigmatized service that we kind of wanted to help bridge and make it a little bit better accessible for those clients. Again, it could be an individual visit to one client, or it could be used, and we have used it as events. So having it on standby for an extra asset to like the larger vaccine clinic that we offer. Some of those clients might need some kind of nursing care, and it's just so handy having that separate private space just located directly. Really, we see it as almost an extension of our physician clinic, a treatment room, virtual appointments with a physician through a laptop that has been explored too. So it's really like you're bringing the clinic to the client, or you're bringing the sexual health clinic or the harm reduction program. I really personally feel it's a tool for every single health service within our health department, just mobilized within the community.